Hi there. Today, knowledge management, week 6. So, what is it? I mean, why are we spending any time looking at this issue? Well, I just want you to think about the idea of an ecosystem, the organization as an ecosystem. And what knowledge management is about is bringing together organizational culture, structure, the IT infrastructure, and people in an interaction in this ecosystem that creates opportunities for sharing, capturing, and building on our understanding, our shared understanding, opportunities for change, development, innovation. And so it's basically the key idea is people plus processes plus technology equals knowledge management. And these knowledge management systems create the opportunity for change and development. So that's the big idea. And the focus for most knowledge management activities, for example, in healthcare, where I worked as an epidemiologist for a number of years, is to support existing operations, look at the opportunities for using knowledge and intelligence and analytics to improve efficiency and lower cost, but also to leverage that knowledge to create the opportunities for change and development that improves productivity, competitiveness, or innovation. Now, more recently, there's been huge developments in the use of artificial intelligence and analytics because of the massively increased speed of computing. We can now analyze data in real time. So, in particular, very big data sets. I want you to imagine Walmart's retail database, the transactions that every time we go in, we can be monitored in terms of how we're behaving just using our credit card data and looking at the patterns of buy that we have. When I worked for Tesco, which is Europe's biggest retailer, much bigger than Walmart in Europe, they hired anthropologists to look at the tribes of shopping. And we did all sorts of things, like very creative stuff, like looking at patterns of behavior by time. And we knew that round about 3:30, 4 o'clock, men would come in on the phone to their partners saying, "What do I need to pick up?" And the partner would say, "You need some diapers for the kid." And the partner would go in and grab the diaper, but think to themselves, "Hang on a minute, I'm in a store that also sells beer. I'll walk around the aisle and pick up some beer." So we moved the beer and the diapers next to each other. So you just do this and walk away, and beer sales rose between 4 and 6 o'clock by 16%. So that was using analytics to make a difference to shoppers' behavior. Now, a lot of data is noise, and data doesn't speak for itself. It has to be analyzed, and we use algorithms to create models and prototypes that we can test against reality. So, for example, in Ontario, a group of colleges partnered with the Higher Education Quality Council of Ontario to see if they could predict from the point of admission who is most likely not to complete a college certificate or diploma program. And the model that they built was refined over time, but it was about 92% accurate. So that's pretty powerful kind of modeling. And using analytics, especially in higher education at the moment, but also in healthcare, we can do lots of predictive work. And using analytics and using it to model intervention. So, I see that you're late on this assignment. I should intervene with you, but I can leave these other 4 people alone. By actually using analytics to guide intervention and investments in students, we can do things like increase retention by 60% and increase graduation rates, the speed of graduation, how long it takes to complete, by about 30 to 40%. So I want to give you some examples of the concrete use of knowledge management in a couple of different sectors, in fact, 4 of them. Let's start with retail. What the prize is for a big retailer like Tesco or Walmart or Safeway is to say, look, we have a 360 view of this customer, and therefore we can optimize positioning of goods, pricing of goods, streamlining of special offers, and we can be very powerful in packaging the offers on the shelf to increase the number of items that you buy each time you visit. In banking, we can make products which have been traditionally not that profitable, much more profitable by using big data analytics and by using our understanding and knowledge of clients. This is especially powerful in the wealth management side of the business. But we can also now increasingly do a lot more asset allocations automatically and reduce the risk of exposure from certain kind of loans to the bank. In the healthcare system, much better at predicting treatment outcomes given the variables we can now look at in terms of test data and how easy it is to track using the Apple Watch, for example, your heart rate. You can actually do simple EKG work with an Apple Watch, and it can be sent directly to a database. So all sorts of uses of data that's coming off, body wear, coming off test scores, coming off other kind of data that we can collect. Massively improving supply chains in healthcare, reducing the risk of iatrogenesis, which is medically induced death. Medical mistakes are the fourth or fifth largest cause, depending on which jurisdiction you're looking at in North America, fifth largest cause of death. And in particular, prescription errors used to be a major problem, but the use of AI and robotics and analytics has significantly changed that pattern. And in education, I mentioned that we can improve learning outcomes, retention, and completion rates using a lot of good data analytics. But there are some challenges, and I want you to think about what some of the challenges of managing knowledge are, particularly in large organizations. Small ones, we kind of let knowledge sit, and we assume we all know, but in fact we don't. And when it comes to succession issues, knowledge management is a massive, massive issue. 5,000 people are leaving the Canadian workforce every week, and they're walking out of the door with all that knowledge sitting in their head. So here are some problems. I'm just going to raise 6, but you might want to think about some others. Tacit knowledge is very difficult to capture. So this is the stuff that I know sitting in here based on my interaction with our clients right now in the business that I run. I know a lot about how to handle these clients. So you can look objectively at the documents and the contracts and the deliverables that we've made available to our client. You can look at their written and verbal reactions. We have video reactions, for example. But what you don't get an understanding of is if you're going to deal with this person at this bank, you need to talk like this, whereas this person at the same bank much more appreciates a blunt, direct Yorkshireman's approach to the world. So that kind of subtle understanding of how to do things, how things work, is critical. And when I worked extensively in forestry, and you walk around a forest trail with a forester who's been responsible for that forest for 30 years, who's about to retire, you begin to understand that he almost knows how this forest is going to look 5 years from now if they did this versus how it will look if they did that. And that kind of tacit knowledge is very difficult to capture. A second issue with knowledge management, particularly using algorithms and AI and big data analytics, is the algorithmic bias that's built into lots of these models. Let me give you an example. In the modeling of higher education in Canada at the institutional level, so if you're at Confederation College, what's the probability of this student completing versus that one? There's very limited data in an individual institution about Indigenous learning behaviour and how different it is and how subtly different it is from a tacit knowledge point of view from the behavior, say, of students from India, students from China, or students who are Caucasian Canadians. But those differences are not trivial. They are very significant, and they impact learning outcomes. So if the modeling is all on aggregates and averages, then these differences between Indigenous learners and Indian learners and Chinese learners and local learners will get lost, and will have a very poor kind of predictive outcome of that data. We saw this in particular when I've been working with my colleagues in New Zealand who are using AI for predictive analytics and student intervention, and we built separate algorithms for Maori learners versus Pacifica learners versus the other learners in the system, for that very reason, to stop the bias impacting the data. A third issue I want to raise, and it comes from some work I did with my colleagues in Finland, Pasi Solberg, who's now in Australia as a professor of education at the Gonski Institute in Sydney. But he and I worked with a man called Martin Lindstrom. And Martin used to work for Lego as a product innovator. And they are great believers in small data versus big data. And small data is when you sit and observe how kids actually play with Lego and what some of the issues are. So, for example, big analytics would never have suggested that you need Lego slippers. Lego slippers is what we should be wearing as grandparents and adults in the house when kids are playing with Lego. So when you step on a piece, it doesn't nearly break your leg. And so Martin and his team developed these Lego slippers, which if you step on a piece of Lego, doesn't really have a big impact because they're built to absorb that kind of experience. But in web development, one of the things that my son, who's a web developer, does quite a bit is to put people in front of web resources he's created and videotape what they do with that, how they navigate the actual spaces. And it's very telling. And when I was in marketing, you to market for Athabasca University, I was a VP external. We did that a lot, looking at marketing ideas and seeing how people reacted to them in small focus groups or in a web space to look at how they reacted to web presence. And it revealed a lot about how we assume people navigate versus what they actually do. So big data versus small data. A fourth issue is that more isn't always better. One example of that is testing of kids in schools for their abilities on maths and literacy. The fantasy of our government here in Alberta is the more you test, the better the results will become because people will start improving their performance when they can see the results. So we test very large numbers of kids often. And it tells us not a lot. We're just looking at a specific behavior at a specific day. What we should really be doing is sampling. And we should sample kids. We're really going to look at your abilities to, do this kind of maths this month. Next month, we'll sample another group of kids and look at a different kind of ability so that we build a deep picture of where we are as opposed to a superficial one. And the superficial one comes from this insistence on testing every kid in grade 7 versus testing samples of kids in grade 7 on different things at different times. So big data isn't always better. And in fact, when I worked at the Medical Research Council in the UK, our assumption was more data was actually more noise, and you should be very careful about sampling. The fifth issue I want to raise is one that I think is very critical. It's the knowing-doing gap. Having an analysis doesn't mean to say you're going to do something. And we're seeing that live right now here in Alberta. It's Easter Monday, we have the worst caseload of COVID-19 cases we've seen in a long time. We're in the big middle of a COVID burst. And the vaccines aren't rolling out fast enough to beat the variants that are occurring with COVID-19. And the Premier and our Chief Medical Officer of Public Health, made it very clear that we were in a crisis situation on Friday, but they didn't do anything. So knowing doesn't lead to doing. And you've seen that if you read your posts about what gets in the way of innovation in your organization. You're full of examples of knowing something with nothing happen as a consequences. So just because you know doesn't mean to say you're going to do. And the knowing-doing gap is actually a big issue in organizations. And the last issue I want to raise is data abuse. We've had really classic examples of this with tobacco companies arguing that tobacco and smoking doesn't cause cancer, and they commission studies. Pharmaceutical companies have done the same. These drugs are fine, there's no side effects, but in fact there are. And there is a whole set of issues around data abuse in pharmaceutical studies, particularly in claims made for products and services, and in big issues like cancer and tobacco, or climate change is another one. It's very difficult to handle data abuse issues, but the trick is to actually understand what the data is and to interrogate data, and always to remember that data never speaks for itself. It's always subject to an interpretation. And I remind you of what we learned from quantum physics, which is whenever we take an observation or make an observation or collect data, the very fact of doing so changes that data. And so, as we observe the real world changes because we're observing it. And anybody who's sat at the back of a classroom watching a teacher in training teach, knowing that they're being observed, is a major variable that affects their behavior. Okay, well, I hope you enjoy this week's stuff. I also made a video in 2013 about knowledge, which is on the YouTube site. I think you should look at that too. I look younger and smarter. We had a studio and we had big cameras and all sorts of equipment. So the production values are better than this one, but I have more to say on this one, I think. So look at that as well. I hope you're having a good week. Bye.